Hello, my name is Curtis Crane from Brownstein and Crane Surgical Services, and this is a video on the informed consent of penile and testicular implants. Today we're going to talk about both the semi-rigid and the inflatable penile implant after phalloplasty and also the addition of testicular implants. If you are a patient that is getting a semi-rigid implant, then you will also get 2 testicular implants in the scrotum. If you are a patient that is getting the inflatable penile implant, then these components go in the phallus, 1 or 2, depending on the width of your phallus. This component is the pump. It goes in the scrotum to pump up the implant and make it rigid. And this component goes just underneath the rectus abdominis, or in the spates of Retzius is what it's called, in front of the bladder, behind the muscles. It can't be felt after healing and the initial postoperative pain is over. And these patients get 1 testicular implant in addition to these components. The reason being is because this pump is in the scrotum, acts as 1 testicular implant. We usually place it on the left side, and then another testicular implant will be in the scrotum so that the right side is also full. So all this plus 1 testicular implant, or the semi-rigid with 2 testicular implants. First, we're going to talk about the benefits of having either implant. The goal is rigidity of the phallus, allowing for penetration. This is a goal, and I would say 99% of the patients that get either implant are able to penetrate, but there is 1, maybe 2% of patients that, despite having these implants, still don't get the technique down of penetrating with intercourse. The implants don't guarantee penetration, although, like I said, 99% of our patients are able to. Alternatives to either of these implants include not getting an implant. Some patients wear 2 condoms and they're rigid enough to penetrate. Some patients rely on external devices that they get online that almost fit as a cage over the phallus and allow for penetration. I don't sell any of these products, and I've never seen one in my office. I just know that some patients discuss these. You can find out more information online or on blogs if you'd rather not have either of these implants. Assuming that you want one or the other, we should now talk about the risks of getting foreign bodies placed in the phallus and in the scrotum in the case of testicular implants. The risks with any surgery include infection, bleeding, wound healing complications. Specifically, the risks of getting a foreign body placed in the phallus or in the scrotum include erosion. The implant goes into the urethra, comes out the skin. The testicular implants come out the scrotum. Malposition. The implant is not placed in an ideal position in the phallus. Usually this is in heavier patients where there's a lot of skin stretch, or with scarring, the implant can move. Failure of the implant. Loss of sensation. This is a very low risk, less than 3%, but it's a risk that I'll get into. Loss of tissue. Some of the tissue dies because of infection, bleeding, swelling. The inability to penetrate, like I discussed, seen in maybe 1 or 2% of patients. Or lastly, chronic pain. Surgery is painful, and in some patients, the pain lasts a long time. So let's go into more detail on each of these risks. The risk of infection is, I would say, 5 to 10% with penile and testicular implants. We do ask that patients get urine cultures the week of surgery, start antibiotics before surgery, and we place patients on antibiotics after surgery. We use sterile technique during the surgery. We take every precaution to avoid infection, but that is a risk with this surgery. Bleeding, I've never had to transfuse a patient blood or admit them to the hospital because of bleeding, but some patients come in with a massive amount of bruising after this surgery. I would say this risk is less than 3%, but it is a risk of surgery. Wound healing complications. This is higher in diabetic patients, obese patients, patients that have an infection, then have an increased risk of wound healing complications. Erosion, when the implant comes out of the skin or into the urethra, or a testicular implant comes out of the scrotum. This is a risk, like I said, of any implant surgery. We very much want scar tissue to form around the implants, be it testicular, the semi-rigid, or the inflatable. But this process takes a few months. During that time, there's a higher risk of implant erosion. We will discuss with you ways to position your phallus to minimize tension across the implant to decrease the risk of erosion, but it is a risk. Implant malposition, like I said, when we place specifically testicular implants in the OR, we place them side by side. There is a possibility one can be a little lower than the other. With scarring, implants can move. Some of you have seen, walking down the sidewalk, a tree next to the sidewalk. The sidewalk's made of concrete. Concrete is a very rigid structure, but you can see after years and years, the tree roots grow and they can actually upheave the sidewalk, malposition it, rotate it, cause it to angle. Scarring is a similar process. Your implants can be placed in a very nice position in the operating room, but as you scar, the implants can migrate up, migrate over each other. I've seen this in maybe 5% of patients. The penile implants themselves can also move. Same, I see this in maybe 5% or less of patients. It is a risk of surgery. You may need another surgery to correct a malposition. We're very careful in placing the implant so that it extends to the tip of the phallus, but if it's abutting against the skin, then that can raise the risk of erosion. So we try not to take the implant dangerously close to the tip of the phallus. We try to position it somewhere between the glands and the tip. This can also lead to a little bit of an SST or tip deformity where the tip is flaccid. We do this because, like I said, we don't want to increase the risk of erosion out the tip. So there's a fine line between positioning the implant in an area that will increase the risk of erosion, but at the same time, we don't want too much of the end to become flaccid because that can lead to difficulty penetrating. These are risks of the surgery. Sensation. Typically by now, your phallus is starting to get some sensation. It will continue to improve for 2.5 years. We know where the main nerves are, but the benefit of having a phalloplasty is that nerves from the outer skin will grow into the phallus. These nerves are microscopic and we don't know where all of them lie. So I have had some patients, 5% or less, say that they were numb for a few weeks or months and then that sensation came back. Certainly it is a possibility that that sensation doesn't come back. I'd say this risk is 5% or less, that you may have less sensation in your phallus after placement of your penile implant. There's a risk of loss of tissue. We know where the main blood supply is to the phallus, but another benefit of phalloplasty is that blood vessels get incorporated and grow into the phallus, as you've healed over the past several months. There is a risk that some of these tiny blood vessels can be cut during surgery that can lead to loss of tissue. I'd say this risk is less than 5%, but it is a risk that everyone should be aware of. There is a less than 1% risk that some loss of tissue can lead to implant erosion, and we have to take the implant out, let the phallus heal, or there have been case reports around the world that there was so much loss of tissue with placement of a penile implant that a new phalloplasty has to be performed. This is very rare, but it is a risk of this surgery. Rigidity. These implants are rigid, but I've had less than 3% of patients say, it's not rigid enough for me. I wish it was more rigid. I can penetrate, but I wish it was more rigid. Or less than 1% saying, I can't even penetrate, the implant isn't rigid enough. You can see you may get 1 or 2 of these implants. There is a good amount of axial rigidity with this semi-rigid implant. As this implant is inflated, it becomes more rigid. But I didn't design this implant, and complaints of the implant not being rigid enough should go towards Boston Scientific, AMS, Coloplast. I do implant these implants because I think they're very rigid, and in general, 98-99% of the patients are very happy with them. Lastly, I discussed chronic pain. It is normal to have pain after surgery. In the majority of patients, this pain goes away within a few weeks. There is a small percentage of patients, less than 3%, where their pain persists weeks, months, years. In a very small number of patients, less than 1%, I have repositioned the implant with concerns that the implant is laying on a microscopic nerve that you couldn't see without an operating microscope. I reposition the implant. In some patients, that alleviates the pain. Other patients, they have chronic pain and need to see a pain specialist. Again, I've seen this in certainly less than 3%, possibly less than 1% of the patient population that we're implanting either of these. Every risk I just went over is included with testicular implants. The implants can get infected, erode, reposition themselves. And like I said, you'd be getting 1 testicular implant with this model. Asymmetry is a risk. This doesn't exactly look like a testicular implant. The testicular implant we place is similar in size, but it doesn't have this shape to it. So asymmetry is always a risk of placing 2 implants. I prefer to place one of the largest girth of either implant compared to placing 2 smaller implants. If your phallus is of adequate girth that you can get 2 of these or 2 of these, then I do proceed with that. But asymmetry is a risk if you end up getting 2 smaller implants of either of these. Implant failure. This implant is relatively simple in design. It doesn't fail as often as this. And when I say failure, meaning the implant cannot be functional. With this design, it's usually because of a leak or a break in some of these one-way valves. This implant, you could probably drive your car over it and it wouldn't break. But it's not as fancy as this implant. It doesn't go down and up. It doesn't get erect and then flaccid. It's always semi-rigid like this. It can be positioned down, up, to the side. One complaint of this implant is that it's not concealable. I have had many patients that don't have any problem concealing this, meaning the patient doesn't always want to appear erect. They just position the implant down and they don't appear erect. But some patients don't like that. Versus this implant, there's a release valve that will be in the scrotum. It's right here on the side. And the fluid goes back in the reservoir by kind of folding the phallus. And then it goes back to being flaccid. However, this is a complex design. There's a study that says that by 5 to 7 years out, 50% of these implants can break. Now, if you go to the website for inflatable implants, the data says that the implant will last 20 years, not 5 to 7 years. This implant, both of these implants were made for 60, 70, 80-year-old impotent men. And they have sex differently than 20, 30, 40-year-old trans men that have a phalloplasty and an implant for the first time. These implants are use dependent. And so that's why there's a discrepancy between our data, 50% breaking at 5 to 7 years, and the data from the company's website. So I have some patients choose this implant because they don't want to have another surgery in 5 to 7 years. But like I said, it is not as natural as this other implant. Probably in the next several years, there will be an implant specifically coming out for trans men. So I have plenty of patients say, well, it's a relatively easy surgery, hour and a half surgery, hour and a half, 2 hour surgery, to exchange this implant if it breaks for another implant. And maybe in 5 to 7 years, there'll be an implant specifically for trans men. I think that's fine. If someone says, hey, I want to be as natural as possible, this implant is more natural than the semi-rigid, I'd like to have this implant until it breaks, and then maybe there'll be something better out. That's perfectly reasonable. That covers infection, bleeding, erosion, wound healing complications, implant malposition, implant failure, loss of sensation, loss of tissue, inability to penetrate, and chronic pain for penile and testicular implants. If you have any questions at all, please ask me, Dr. Chen, or any of the other surgeons in the practice, or view our website. Thank you for your attention.